In this section, I want to outline some of the important measurements that we might be looking at to ensure that a low carbohydrate, low insulin lifestyle is safe and effective for you. Many patients who are not on medications and do not suffer any of the components of the metabolic syndrome will not require advanced medical monitoring, and some of these tools are going to be completely elective. But other patients can have great value added to their progress, the insights, and the way that they are going about their lifestyle change. What to measure? Well, it's critical to measure your progress to ensure you're on the right track and provide you with accountability. Weight is one of the easiest things you can monitor, but it's just one reflection of your internal metabolic health. There are other important health measures. So blood tests, including the hormonal response to glucose, can be very helpful. Most patients will require blood tests to ensure the treatment is customized to their metabolic profile. There are a few key tests, including fasting glucose and insulin, and sometimes a 2-hour glucose and insulin tolerance test. Hormones at baseline, micronutrients, uric acid, liver function tests, and markers of inflammation can all be helpful baseline tools to assess health. Weight measures are undoubtedly important and worth monitoring with a consistent scale, but weight changes or lack thereof can be misleading and disheartening. Waist circumference acts as an indirect measurement of the fat around your abdominal organs, otherwise known as the visceral fat. This fat, as opposed to subcutaneous fat under the skin, seems to have the strongest links to inflammation and poor cardiovascular health. We use a standardized measure 35 centimeters below this notch here to ensure accurate tracking. Less than 90 centimeters is preferred for men and less than 80 in women, according to our criteria in Australia.
Now, ketone bodies are water-soluble molecules made during the process of fat burning in the liver. They can be used very efficiently by most cells in the body, and there is a wealth of developing evidence around their potential neuroprotective and anti-inflammatory effects. And whilst these ketone bodies are the key characteristic of a ketogenic diet, they provide many but not all of the benefits of therapeutic carbohydrate restriction. Ketones are only made in significant quantities when insulin levels are low.
A fantastic, accurate way to measure ketones is a finger prick, the same way a diabetic would check for glucose, but using a special strip for ketones. They're much more accurate than breath-or urine tests, and packages can be obtained online or sometimes at pharmacies to allow you to measure this. They're best measured at a consistent time for you, and you can experiment with the time of day that you find tends to be highest.
Aiming for at or above 0.3 millimoles.
The CGM, or continuous glucose monitor, is an excellent biofeedback tool. It is both an accountability tool, it motivates patients, and it identifies barriers to progress. I'll have another video that outlines how to get the most out of this particular tool. It's basically a small device or sensor that sticks on your arm with a tiny filament that pokes into your skin, which you can't feel, and it measures blood sugar continuously for 2 weeks, giving you real-time feedback on your phone. And it's particularly useful in patients who have tried everything and are not seeing results. They help identify factors such as fasting periods, sleep, exercise that might be helping or hindering. Now, consistently low levels of glucose, stable levels of glucose, translate to good metabolic health, and weight loss tends to follow. If you can afford this, even for a 2-week intensive period through your journey, it's highly recommended. And now they can be ordered online from Abbott, and you can certainly be given a letter of recommendation from your doctor. Tips to get the most out of your continuous glucose monitor include checking your blood sugar periodically with a finger prick to see how accurate your reader is if you think it's off. Otherwise, it will remain consistent even though it might be above or below your blood level. Measuring frequently to get as many data points as possible, at least every couple of hours during the day. Keeping notes on your device to ensure you then understand what keeps your sugars going up and down. Avoiding immersion and avoiding damage to the device by being careful when you get undressed or go swimming. And accepting that there are times where it will be a little bit inaccurate or underestimate your sugars, such as when you're lying on it at night time, or it might go up a little bit if you have a hot shower. Respiratory exchange testing is an advanced test that's only recommended for patients who are struggling despite the above measures, or sometimes in elite athletes with specific goals. Our bodies can use multiple fuels, including fat and glucose, kind of like a car that can use E10 and diesel. And this ratio tells us about a person's metabolic flexibility, that is, their capacity for fat and glucose burning at different states of energy use, from rest to maximal exercise. At lower intensities of exercise, we're meant to be burning more fat, but as the intensity increases and we switch to using fast-twitch fibers, we use more glucose. But metabolically impaired people use glucose as their main fuel even at rest and burn extraordinarily little fat. Now, Lumen's an excellent new device that allows you to measure your own fat burning at various times of day and titrate your exercise to effect. The autonomic nervous system includes all the nerves in our body that control the fight or flight, the sympathetic, versus rest and digest, parasympathetic responses. Persistently high stress levels can limit fat oxidation, and the beat-to-beat variation in our heart rate reflects the balance of these two systems. Now, on one end of the spectrum, athletes have a very active parasympathetic nervous system and lots of variation between their heartbeats called sinus arrhythmia, while very sick patients have virtually no variation from beat to beat, much like a metronome. Now, while we eventually will be able to measure the hormones that control this stress response in real time, such as cortisol, heart rate variability is considered a very good estimate of stress and recovery. Now, common options include using wearable trackers like an Apple Watch, a Fitbit, or an Oura Ring. And the reason you might consider investing in these sorts of things is that persistent pain or chronic stress can really undermine your progress, both behaviourally by affecting your cravings, willpower and consistency, but also physiologically by driving further fat storage and increasing hepatic glucose output. Now, the thyroid gland is a shield-shaped gland that sits just below the voice box, and it's a master regulator of our basal metabolic rate. This is the energy usage that occurs to run our basic functions that keep us alive, our heart, brain, breathing. Problems with the thyroid can occur slowly and insidiously. The standard thyroid blood test is an indirect measure of thyroid function and might not detect problems until they're more significant. But a screening ultrasound can also identify any nodules or cysts or other problems that might hinder progress and lead to health issues. Most patients will be recommended to undertake a full panel of direct thyroid tests. Carotid Intima-Medial thickness. Although no imaging test has ever been found to accurately predict cardiovascular events, there are associations with thickening of the artery walls that can tell us about cardiovascular risk. A special ultrasound done in the rooms called Carotid Intima-Medial thickness, or CIMT, is a non-invasive test that can be useful to monitor plaque formation in the arteries of the neck. And this is a de facto measure of overall plaque in the arteries, including those that supply the heart, the coronary arteries. The coronary calcium score is a nuclear medicine scan that also approximates cardiovascular risk in patients, particularly those at medium risk, and it can help re-stratify their risk as high or low by calculating the amount of calcium in their coronary arteries, which supply the heart muscle. Now, while a score of 0 is very reassuring, plaque can be non-calcified, which means the test is not perfect, but it is non-invasive and very helpful to gauge the risk in middle-aged patients who are in that medium risk category. A DEXA scan, or dual energy X-ray absorptiometry, can tell us very precisely about body composition and bone mass with very low levels of radiation. This can be helpful in patients who have had multiple or unusual fractures to diagnose osteoporosis or osteopenia, but also patients who are looking for improved metabolic health, because the main benefit is that you can accurately measure the amount and distribution of both fat and muscle or lean mass. No scales can really do that well. And increasingly, we have an awareness of not just losing fat, but also gaining muscle to restore metabolic health. Now, the process is quite straightforward. It takes about 5 to 7 minutes whilst lying down as an automated beam scans up and down your body from head to toe. As I said, the radiation dose lowered about 1 background day of radiation, which is much lower than an international flight or chest x-ray. And the test can be repeated every few months to follow up and compare, and importantly, target and individualize and prioritize your exercise habits to get the maximum benefit for you. A range of advanced tests are also available that can assess the cause and risk profile of elevated cholesterol to assist with minimizing this aspect of cardiovascular risk. The only index of cholesterol that's been consistently shown to correlate with cardiovascular events is the number of LDL particles, as opposed to the concentration. Now, the best measures available in Australia are the ApoB levels and lipid subfraction electrophoresis. And both of these can help identify atherogenic or plaque-causing cholesterol particles. Another test is Lp(a), which is also associated with increased risk. Elevated blood cholesterol levels may relate to any combination of increased synthesis in the body, increased absorption from the gut, or a lack of clearance from the circulation. And precursors for the cholesterol molecule measured in the blood and cholesterol-like particles called phytosterols can tell us about synthesis and absorption respectively to direct the most appropriate treatment. This testing is called sterols testing and is only done in a specialised metabolic lab in Australia. So, as you can see, there's more science than ever before to optimising metabolic health. Without using calorie-restrictive diets, we can achieve consistent, long-term improved health and weight in our patients, and actually measure the health biomarkers that matter. I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.